Hi everybody and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and co-author of the Kidney Disease Solution. And I'm joined today by the beautiful, amazing, wonderful Emily Cahill. She's a regular on the YouTube channel. I'm sure if you've watched any videos, you'll know exactly who I'm talking about. But just in case you're new to the channel, number one, welcome. And number two, Emily is a registered nurse. She works in a large cardiovascular unit here in Melbourne, Australia. She's also a qualified naturopath who has a special interest in all things kidney disease, of course, and cancer and oncology. And Emily is our only qualified kidney disease solution kidney coach around the world. So if you ever need help navigating the kidney disease solution, that's the amazing Emily that will help navigate that with you and check medications and all of those sort of things. And when Emily is not busy writing with us or busy working at the hospital or seeing patients in her own private practice, you'll probably find her patting her horse Oscar. Not that we can do much these days, hey Em?
No, exactly.
So today we wanted to cover off an important topic that we get asked about a lot, and that's vitamin C. So vitamin C is a part of and if you're following our kidney disease solution, you'll notice it's one of the major 4 nutrients that we recommend as one of our phase 1 nutrient lists. But one of the common emails that we get, and I'm sure Emily is often answering our emails, and I'm sure you get this question all the time, Em, is that can you take vitamin C when you have kidney disease, because doesn't vitamin C increase the risk of developing kidney stones? So we definitely want to cover that off as well, and to talk about why we include it as one of the major nutrients as part of the kidney disease solution, because it's very important in chronic kidney disease. And I will just say, if you hear banging and crashing in the background, it's because that nose pointing up in the side is my puppy. And I've just moved house and he's getting used to it, and he's chewing away on a bone on my leg here. So I apologize if Apollo is a bit noisy. Here's his lovely nose. So Emily, do you want to, you wrote the latest blog on the vitamin C. I might let you start with, maybe we'll just cover what it is and then we'll get into the nuts and bolts of why it's important in chronic kidney disease and why it might actually be okay even if you're a bit prone to kidney stones.
So vitamin C is a water-soluble vitamin, and it's a vitamin that our body can't produce itself. So it's something that we have to get from our food and at times from supplements as well. It's got a wide range of different actions, and it's often, probably well known for its role in the immune system function, but it does a whole lot more than that. It's really important, particularly for our collagen and our connective tissue in the body. So that's everything from skin, bone, cartilage, ligaments, tendons, our blood vessel walls, particularly as well. We need it to make some of our neurotransmitters. It helps the body absorb iron, so it can be useful for people who have iron deficiency, which is common with people with kidney disease. It's an antioxidant. So if you've watched any of our other videos, you will have heard us talk about antioxidants or read any blogs and how important they are for our health as a whole, but particularly for kidney disease. It also reduces inflammation, and it helps to reduce a lot of cardiovascular risks as well. Generally, we get a good amount of vitamin C from our diet, but people with kidney disease particularly can be at risk for vitamin C deficiency because it's found in a lot of our foods that also contain potassium. So a lot of our fruit and vegetables. So if people are following a low potassium diet, then they're at a higher risk of being deficient in vitamin C. And also if we've got, if anyone has proteinuria, which is loss of protein in the urine, which can happen with kidney disease, it means that we can also excrete more vitamin C as well. Then there's some certain medications which are quite common in people with kidney disease as well that can deplete vitamin C levels. So things like diuretics, so things that are increasing urine output, and aspirin as well can reduce vitamin C levels.
Yeah, so definitely a major important nutrient there, especially like you say, because of antioxidant value. So why don't we walk people through why do we see in the kidney disease solution, why is it one of our top 4 nutrients? Why have we got it there despite all the other stuff that people are worried about with kidney stones? Why is it something that we've included as one of our 4 major things that you should take if you've got kidney disease?
Yeah, I guess sort of a few of the main reasons are its antioxidant and anti-inflammatory actions. So high levels of antioxidants or free radicals cause a lot of damage within the body, including to the kidneys, also cause a lot of inflammation. And so we know that vitamin C in studies has been shown to reduce that sort of oxidative damage and inflammation and injury to the kidneys as well that can occur as a result of that. And one of the other really important actions of it is its action on our endothelium. Excuse me. So our endothelium, it's a thin membrane that lines our blood vessels and the inside of our heart. And it's got a few different functions. It releases substances that actually control the contraction and relaxation of our blood vessels. So that's important in terms of both blood pressure, but also getting enough blood and oxygen around our body. And also enzymes that help with controlling blood clotting. So if our endothelium isn't functioning very well, or it's dysfunctional or impaired, then we get things like high blood pressure, we get various different vascular diseases, increased risk of heart attack and stroke because of that blood clotting, and also can impact on things like diabetes. And if you think about our kidneys are made up of thousands of little blood vessels. Like that's what they're mostly made of. So if those blood vessels aren't working properly, then that's when we start to get reduced oxygen and blood flow to the kidneys. We start to get higher blood pressure, which we know then can go on to cause more damage. And in people with kidney disease, that endothelial damage is believed to be a really important part of progression of kidney disease and progression to end-stage renal failure. So it's definitely something that needs to be addressed, and vitamin C has been trialled. Like there's been meta-analyses and large clinical trials that have shown that it is really beneficial for endothelial dysfunction and for reducing cardiovascular risk for that reason.
Yeah, and I think when Duncan and I put the program together, when we looked at the best nutrient to do it, the one that had the most clinical trials, the one that was the most well studied with really out a lot of adverse reactions, vitamin C being, like you say, water soluble, you're going to flush it straight through. If you get too much, the worst you're going to get is some diarrhea. It's really innocuous and really quite a very safe sort of nutrient to take. And so because we couldn't find anything that just hit all those areas as well, that's why vitamin C got included. So that being said, let's talk about the potential issues. And I mean, I know how many research papers I've waded through around the correlation between vitamin C and kidney stones. So yeah, I'd be interested to see what you came up with the research and if it's the same as mine.
So the whole idea that vitamin C causes kidney stones was made on an assumption, really. So what they saw in studies is that vitamin C is metabolized in the body to oxalate. And so you can see when people are taking vitamin C that their oxalate levels in their urine can increase. So it was assumed that because oxalate levels have increased, it's going to cause calcium oxalate kidney stones. But that wasn't actually proven in studies. So they've done, massive studies with over 80,000 people. I think one of them was for, over 14 years, where people were taking, various doses of vitamin C up to quite high doses, and there was no increase in kidney stones. And in fact, because of some of the actions of vitamin C, in some studies it actually showed a reduction in kidney stones because it has a bit of a diuretic action in the body, which means that urine sort of flows faster. And so faster flowing urine means that there's less capability of oxalate and calcium to join and to lodge in the kidneys. And also because it's got an immune boosting sort of antimicrobial action as well. And stones can frequently be formed if there's some sort of infection as well going on within the urinary tract. So yeah, this, putting two and two together doesn't always make four. So yeah, it was basically, made because of an assumption that hasn't actually been proven in research, and it's just been picked up as a belief.
I know it's my greatest frustration, because if you Google vitamin C kidney stones, they're all, like WebMed and all of these places with no research to back it up will say that there's an increased risk. I think the one study I found was a potential increased risk in males, but when I actually looked at how they did the study and everything, again, they were just putting 2 and 2 together. It wasn't actually a double-blinded placebo-controlled trial where they put people through that. And everything that I found is the same as yours. I've read the same study. So especially that big longitudinal one that was over 14 years, that there was no increased risk, in fact, benefit. So I mean, that's one of the things with Google, it's great. And that's also one of the things with Google, it's not great. So, we try and base all of our research, and when we put the programs together, it's all based off clinical trials. Emily and I have access to, well, I'm assuming you do, Em, but through being a nurse and stuff, but we've got access to proper clinical trials. We can get in and not just read the abstracts. We can read the methodology, see how they're put together, make sure they're placebo, double-blinded, all of that sort of stuff. And I'm yet to find a convincing study that actually says that vitamin C will increase the risk of kidney stones. So I wanted to put that on a video and try and put that to bed, because it's a question we get a lot. We get a lot on the Facebook pages. People will comment all the time, and it's coming from a place of it's not correct information, and it's not coming from a place of proper clinical trials and what the studies show. So I just want to put that out there, that vitamin C will not increase your risk of kidney stones. The only time I may err on the side of caution is if you've got a proper oxalate issue due to gut issue stuff, and maybe your liver is not conjugating properly, and there's that where it's an oxalate issue. Even if you're eating certain vegetables, you're more likely to get kidney stones and things like that. Maybe then you'd work on your liver, and maybe you could look at it. And that would be if a patient came in and they were super gouty, or they had other sign, I'd run an organic acid test and their oxalate levels were off the Richter scale and their liver function was down, they're not conjugating properly, I may wonder about it, but only because I'm trying to do a duty of care to a patient versus actually thinking it might be an issue. And I'd probably wean them in slowly, get their liver working, and then I'd put them straight onto vitamin C. So any words of any caution that you would do around that, Em?
Yeah, no, I would in that sort of circumstance as well, I would. And I think the other thing to point out is that, yes, there are case reports that you can find in journals about people who have developed kidney stones who were taking vitamin C. Now, we've got to think about the number of people worldwide who are taking vitamin C.
Especially now.
Yeah, of course, there's going to be some people who are naturally going to develop kidney stones, and they just happen to be taking vitamin C. So just because, and often the case reports will blame the vitamin C as being the cause, but, if you look at it that way, you could attribute any vitamin, herb, food, whatever else you want to do to kidney stones, because some people develop kidney stones. But It has actually nothing to do with the fact that they're taking vitamin C. So I guess that's the other part of it, when people are like, oh, well, I read a, and yes, they are in journals. I read a journal study that said that this happened to this one person, but we've got to remember that just because they were taking vitamin C, it doesn't mean that's the cause. There's, just the way it works, there's going to be some people taking vitamin C who are going to develop kidney stones who would have developed them either way.
Exactly. I'll give you a great example. My brother-in-law developed kidney stones last year and was really sick with it. And actually, his was more a purine kind of, it was an oxalate kidney stone, but drinking too much beer and all those things that we know make you acidic can contribute. And one of the things I put him on was high dose vitamin C because he needed antioxidants. And guess what? His kidney stones are cleared up and they've not come back. And they run in his family. They're very prone to them. And so he's still on vitamin C. He was over here the other day helping him move house. And I checked in on him. And so he's still taking his vitamin C and he's kidney stone free. So yeah, it's a really good point, Emily. And that's that whole, I don't know whether medicine likes to just blame herbs and nutrients. Yet if we have a drug reaction, no, it won't be the drug. Anyway, don't take me down that rabbit hole. So yes, please make sure when you are doing research that you're looking at the big meta-analysis, and Cochrane reviews are a really great way to go and have a look at that. So what else do you want to say about vitamin C? What sort of, so let's talk about dosages, side effects, the types of vitamin C, because there are very different types in there. Is there one that's better if you are prone to kidney stones? And how and when would you take it?
So dose wise, when you look at the actual therapeutic dose of vitamin C, it's massive. And that also gives you an idea about safety as well, that people are able to take really massive doses without side effects. But as a everyday sort of nutrient in terms of looking at its benefits in kidney disease, we generally recommend 1.5 grams. And I generally recommend that people take that in divided doses throughout the day if they can. We know that the body only absorbs a certain amount of vitamin C per dose. So if you're taking the whole 1.5 grams in one go, then you're only going to be absorbing, sort of probably around 500 milligrams of that. So taking it in divided doses is good. It is a water-soluble vitamin. So what the body isn't using, it is going to excrete in the urine as well. So it's, and I guess that's the other point about it. Because of that, it's not something that your body stores or sort of builds up in the system. So it is something that you have to be taking regularly to have a beneficial effect. And then, there are a number of different types of vitamin C. And I guess that's the other thing to have a look at. There is vitamin C, calcium ascorbate, magnesium ascorbate, ascorbic acid. And I guess the main thing that I would look at here is if people have, high calcium levels, that making sure that they're not taking the calcium ascorbate, because you do also absorb what the vitamin C is bound to. So just being aware of that. You can get, potassium ascorbate as well. So for people with high potassium levels, obviously avoiding that one would be important. But I don't know. Do you know if any are better for people who may be at risk of kidney stones?
Yeah, so I think yes. Now hang on, I'm looking at it because it's in the one that's in my cupboard. It's the one in the C caps, but it's the Biomedica C caps that I'm thinking of. I tend to take a blend. So the vitamin C's that I tend to use are a mixture of about 4 or 5 different types. I know that if you are prone to kidney stones, you stay away from calcium ascorbate. That's the one they always say. So, and then, citric acid, sometimes people tell you to stay away from that if you're prone to heartburn and reflux and those sort of things. But I tend to like I tend to use them in a mixed version, and just so they hit different parts of it. I mean, the thing that they're bound to is called it's chelation, isn't it? Because I know minerals are what they chelate, but vitamins, is it technically a chelation when you're adding a vitamin C to a potassium? Is that still fall under that bracket?
I don't know.
No, chelations I think are more particularly minerals, but I'm not sure about vitamins. That's terrible that I don't know that off the top of my head. But so you bind vitamin C to something else to help it into the body. We do that with magnesium, for instance. It comes in all different forms, and the way that it binds it is it influences different parts of the body that it easily crosses to. In fact, I would say that if you do want to take vitamin C with kidney disease, probably the liposomal is going to be the best for the endothelial, because that's going to get into the cell membrane most. So that's probably actually the one that makes the most sense. So there is a type of vitamin C called liposomal vitamin C, and that's bound in fat. Usually they're using lecithin. Thank you. Lecithin. It's bound in that way. So so that actually helps the vitamin C. So it carries the molecular vitamin C across the cell membrane and actually takes it into that endothelial tissue that Emily was talking about. So I would probably say liposomal would be my preference in kidney disease rather than all the others. And that liposomal vitamin C is not the easiest to take. You get it in a sachet and it's a jelly kind of thing, and it's not like chewing a nice tablet or putting a nice flavored powder into some water. It's because it's fat bound, it's jelly-like and not as delicious. But I would say that would be my pick for kidney disease. That's probably the best form of vitamin C to take. And I think studies, and I'd have to go and look at the quality of those studies. They were a while ago when I looked at them, but studies did show that liposomal vitamin C seemed to be more effective in bolstering immune function. So I think it's just better absorbed, especially too if you're cardiovascular disease, diabetes, you've got, maybe you haven't been eating as well and maybe there's some gut issues there, then liposomal, I think, would be the best anyway. Yeah, that would be my take on that. It is more expensive though, liposomal vitamin C. So, but that being said, you have to split the dose still, but you can get away with taking a bit less of it too. Kind of works out. The other way to do vitamin C is obviously IV infusion as well, which is how I do vitamin C. So I go and have an infusion once a month of vitamins, and I run vitamin C through there. And as it's going, you can taste it. So that's the other way. And of course, IV vitamin C and things like cancer has been, and you would know that, Em. Are you prescribing a lot of IV vitamin C in, say, in oncology patients? Can't talk today.
Yeah, it is something that the research is showing is really beneficial. The trouble that I tend to have is oncologists are not on board with it. So, block it.
Right. Excellent. But would you think maybe some IV vitamin C, I'm just thinking maybe getting it through that way would take maybe some of the burden off through the kidneys and things like that? Would that be another really good solution to do it? I mean, we want it to hit the endothelial tissue, so I don't know whether IV is as good as maybe a liposomal, but...
Yeah, I guess I would probably still stick with oral or liposomal in those cases. And probably only because, generally speaking, and again, it doesn't have to be done this way, but generally speaking, they're very large doses of vitamin C that people are getting in IV. So, which, for things like cancer and things like that, they have to be. But yeah, I'm not sure.
Yeah. Okay. Well, we'll stick with liposomal being our go-to for vitamin C and kidney disease. That one makes the most sense from all the research and everything that I know. And that means then you can take small amounts every day, because you're writing in cancer cases, and I'm using it in autoimmune diseases. I trying to hit people with a great big dose once a month or once a week, and then they're still taking some form of vitamin C during the week as well. So, all right. What else do you want to say about vitamin C? Any drug interactions, anything people should know about if they're taking blood thinners or anything like that?
No, it has very little. Well, I didn't think I came across any real drug interactions. No issues with increasing bleeding or anything like that. I think there was one study about it being used with Lipitor, so with statin drugs, that does sometimes come up, where it appeared to potentially reduce the action of it. However, it was tested with vitamin E. I think it was vitamin C, vitamin E, and then when previous studies were then done after that, actually looked like it was more the vitamin E as opposed to the vitamin C. So that will sometimes come up on databases if people are checking for interactions, but it's not one that I would reduce the dose for.
Okay, great. Awesome. Well, that is everything you need to know about vitamin C. So hopefully our aim today was to generally cover off the misconception that vitamin C is going to increase your risk of kidney stones. That's really the big thing that we wanted to cover today. And also too, if you're following the kidney disease solution, why vitamin C is part of our 4 main pillars. And it's really that action on that endothelial cell tissue to really, as an antioxidant, and to really regulate endothelial tissue. And as we now know the studies, it's very safe, very few interactions, and it really will help slow the progression of chronic kidney disease. So it's a really fabulous nutrient with no side effects. Excuse me. All right, Em, well, thank you for joining me today with the amazing vitamin C. Now, if you like this information, make sure you hit subscribe. That way you'll get notified anytime that we make new videos. If you want any comments or questions, if you put something in the comment, I check them most days. I'll get back to you. And if there's any content that you want to hear or any blogs that you want Emily and I to write about, make sure you put that below. We're definitely going to cover some topics in the next couple of days of things that people asked us to cover. So we'd love to hear from you. We're always looking for ideas of what we can write and talk about. So yeah, so until next time, we'll see you then. And thanks again for being part of our community. And Emily, thanks again for your time.
Bye.
Bye.